Today we are here to examine how healthcare sectors contributing to the climate crisis can better improve their efforts. The ways that extreme weather events are disrupting the healthcare delivery system nationwide and what's needed to safeguard our healthcare infrastructure from these changing conditions. Last year, the medical community cited climate change as the greatest threat to the global public health. Our health is in large part determined by our environment, from the air we breathe to the water we drink to the access we have in terms of healthcare services. We know that human-caused greenhouse gas emissions are the most significant factor accelerating the climate crisis. We also know that the healthcare industry is responsible for 10% of our nation's greenhouse gas emissions. But we haven't spent enough time thinking about how these trends go together, how the healthcare system contributes to the climate crisis, and how changing weather patterns impact health. When it comes to extreme weather, last year alone, we saw a historic freeze in Texas, the third most named hurricanes in history, and the hottest summer on record. All these events affect our health. Texas healthcare operations were disrupted when hospitals and emergency departments were overwhelmed, and over the past 2 decades, it is estimated that 114 climate-related hospital evacuations took place. More than half of those meant evacuating more than 100 patients. These are serious threats to America's health. From providers to suppliers to the many other actors in the sector, all have a role to play in curbing emissions and preparing for the increasing instances of extreme weather. Another factor to consider is how these changes exacerbate existing health inequities. Back in 2019, the committee held a hearing on the economic and health consequences of climate change, and where we had an opportunity to hear loudly and clearly that the impact of climate change doesn't fall on all equally. Rather, the communities that are already the most vulnerable remain the least equipped to deal with the added stressors of climate change. The U.S. healthcare system is only beginning to feel the damaging effects of these changes, but it is clear that more climate-related weather events and rising emissions will continue to worsen healthcare outcomes, and the time for action is now. Making important upfront investments will not only protect our healthcare system for weather-related risks, but will also offer potential cost savings to organizations in our healthcare system. Earlier this year, and this is what has brought about this hearing, earlier this year I released a request for information to providers across the country, asking them about the ways extreme weather events are interrupting their operations and also what they were doing to reduce the carbon footprint. I'm really pleased that along with this hearing today, we have released a majority staff report that aggregates those findings. Once again, the health staff at Ways and Means did a spectacular job. It is clear that we have a lot of work to do together moving forward, but honest dialogue and commitment to change are amongst the first steps. Today's discussion is an important step to understanding the role of the federal government and how it plays out in supporting how healthcare facilities respond to climate crises issues and mitigate their contribution to it. We need to encourage urgent, measurable action. There's no one-size-fits-all, but the federal government can move the industry from a piecemeal approach to intentional, comprehensive strategies.